Hello, everyone. My name is Charles, and today I'm presenting my project evaluating patient experience and emergency efficiency using the eLife mobile application for sickle cell disease management. And we're doing it at my hospital here in Atlanta, Emory Hillandale. So, break down the background for this is there's well documented and serious gaps in emergency care when it comes down to taking care of sickle cell patients. There's many quantitative studies consistently show that delays in analgesic administration lead to horrible outcomes, increased return visits within 72 hours, and the patient satisfaction is abysmal. So in addition, their qualitative research shows that many patients avoid the emergency department for over 72 hours when in crisis, just due to the stigma, long wait times, and having to repeat their medical history over and over again for everyone they encounter. The fragmented medical records and inconsistent communication, it just delays their treatment, and their experiences that they have are just horrible. These barriers make it clear that we need a streamlined method to avoid to quickly access patient information at the point of care. So the purpose of the solution is really to leverage technology to address many of these inefficiencies. Specifically, a strong systematic review evidence reports the use of wearable devices and NFC-enabled technology. It provides fast, secure access to key patient information. NFC has been proven to be one of the quickest and safest ways to retrieve patient data, especially in emergency settings. And the goal of this is to evaluate whether or not using the eLife mobile application and NFC wearables improve emergency care efficiency, enhances patient-provider communication, and ultimately improves the patient experience for adults. So by integrating these two technologies into the ED workflow, we expect several benefits: faster and more consistent triage and pain assessment from the nurses, reduced redundancy and fewer repeated history explanations, improved communication between the patients and the doctors that are caring for them, and a much stronger trust and engagement with the healthcare system as a whole. Better alignment with the CMS values, which the facilities have to adhere to. These standards have to be adhered to. And ultimately, this project seeks to reduce the delay in care for adults living with sickle cell disease and ensure just more equitable and dignified emergency care services experiences for them and their families. So the theoretical framework we're following for this is going to be Johns Hopkins Evidence-Based Practice model. It's really guiding identification of the practice gap, generation of the evidence, what evidence supports it, and then an implementation strategy to make this thing really work and go through. We're also looking at the technology acceptance model, which really predicts whether staff, the emergency room staff, will really adopt the technology, and that's really based on their perception of usefulness and the ease of use. These frameworks will help us measure not only outcomes, but the acceptance and feasibility among frontline emergency department staff. So our target population includes approximately 30 adult patients with sickle cell disease who visit emergency department at Emory Hillandale Hospital, but they'll also be allowed to visit hospitals outside of Emory. And they will do, they have a observation window after they have an emergency visit that they'll use a JOT form, which is a HIPAA compliant device, to fill out their ED PEC form, which is their ED experience, patient experience form. And it's 10 questions, and it asks them basically, what was their door-to analgesic time? Did they feel like they were involved in the care that was delivered to them? Was the staff nice, or did they feel like, they really were competent in what they were demonstrating to the patients? And it's really a patient satisfaction survey. And understand this, all human subjects will be protected in this. We'll do an IRB prior to doing any implementation or any project going forward, because we want to make sure that patient data is being totally safe and HIPAA compliant, and that we're not putting any patients at risk, especially vulnerable patients like sickle cell patients. So if this project is proven effective, technology could align with CMS teams initiatives, Georgia Medicaid performance measures, and hospital operation efficiency and goals. The scalability extends beyond sickle cell disease. Any chronic condition or high acuity population would benefit from the outcomes that we get from this particular study. In conclusion, this pilot will help determine integrating the eLife mobile app and NFC wearable technology can improve emergency department efficiency and reduce delays in care and enhance trust among adults living with sickle cell, as well as a much larger and broader group of chronic disease patients that come to the emergency room frequently, renal patients, diabetics, or heart failure patients as well. So I thank you for taking the time to review this project, and I look forward to sharing further insights as the study progresses.